With the next two lectures, we're going to be segueing into what they refer to as vesicular or pustular rashes. Two of the predominant ones are going to be what are due to diseases known as chickenpox and smallpox. You look to the far right there, the chickenpox and the smallpox. We don't see this large area rashes, rashes that are going to completely cover the face, the trunk. Here what you're going to have are little spots, little vesicles that are going to be filled with clear fluid or pus. And these spots will be all over the face, the head, the neck, the trunk. For chickenpox. For smallpox, this one, as we're going to see in the next lecture, even worse. It will be head to toe, top of your head, bottom of your feet, everything in between, in your nose, in your mouth, down your throat. These pustules can, appear in your lungs and whatnot. Let's begin with chickenpox. Chickenpox is not a problem nowadays because we have the vaccine, which we'll talk about shortly. But back in my day and age, up until a few decades ago, they would literally have chickenpox parties. One little kid would get it, and the next thing you know, the call would go out and all the moms would bring their kids together to that one kid's house. So that way everybody can get the chickenpox all at once, get it all taken care of, because it's one of those diseases, one of those infections that for the majority of the population, you get it once in childhood and you never get chickenpox again. You have lifelong immunity. Here's the thing, you get exposed today and you have an incubation period that's going to be about a week and a half to 3 weeks in length. You're going to start to get a rash. Begins on the head, the face, the scalp, and then spreads down. Face, scalp, little spots, little pustules all over. Spreads down the neck to the trunk slowly to the arms and the legs. And they are itchy. The starts off, you see there, the lesions progress quickly from macules and papules to itchy vesicles. The macules and papules are going to be raised slightly hard to the touch lumps. Very small, extremely small, size of a small freckle. And then over the few days, they will soften. They'll still be firm, but they will soften a bit, and they will now be filled with a clear liquid. And for whatever reason, when they hit that point where they're a clear liquid-filled vesicle, oh, that's when they itch the most, and you scratch. Well, it turns out the scratching, the breaking open of that vesicle, releasing that clear fluid, the clear fluid is actually remnants of your cells. Remnants of your cells that were infected with the chickenpox virus. So that fluid is actually filled with thousands to millions of virus particles that as you itch them and that fluid comes out, spreads across your skin, spreads to other areas, spreads to other people. If you can keep the child from scratching and itching, which is always a hard part. Heck, you see pictures, old pictures where moms, to keep the kids from scratching, would literally tape winter gloves on their hands so they couldn't scratch with their nails. So if they could keep them from itching and busting open the vesicles, because a burst open vesicle releases the virus containing fluid, but it also inevitably gets a bacterial infection. If they can keep them from scratching, within a few days, those vesicles will all start to crust over, scab over, and then a few days after that, dried, healed completely. For the most part, they don't leave scars. If they did scratch, they did itch, burst them, there was a bacterial infection, there will be a scar, if not a pockmark. Weird thing, the older the patient is when they first get chickenpox, when they get the chickenpox, the more scarring will occur. So young children can get away with this, almost no scars, whereas adults, teenagers, adults who get chickenpox, there will be scars all over their body. The pox, as I said, starts at the head, works down to the trunk, and then spreads out. What's interesting is as it spreads out from the center line, they become more and more diffuse. So the higher concentration of the little pox, the little pustules, the vesicles, will be face, head, and trunk, center of the trunk. All told, after the 10 to 20 day incubation period, it's going to be about a week total of the chicken pox. And it's not all at once, here's all the pox, and then you got to wait a few, then you wait a week for them to dry up and everything to be okay. No, they're going to appear over like a 4, 5, 6 day period. More and more will appear. The older ones will begin to dry and crust as there's still new ones appearing. One of the things I didn't talk about in the previous chapter, very rarely are there any secondary issues. There have been some cases, very few, of children, some adults getting meningitis and whatnot from the initial chickenpox infection. What's becoming more and more of an issue is what is known as shingles. This is an adult onset of a latent chickenpox infection. Remember, we talked HHV6 a few lectures ago. Here we're going to be talking about chickenpox, which turns out is part of the herpes family. Chickenpox, also known as herpes zoster. You will get an infection early childhood, adolescence. You'll go through that whole 3-week trial ordeal. Everything will heal up. But the virus is not completely cleared from your body. Some of the viruses will become latent in the nerve ganglia. Okay, the nerve ganglia. This is the area where the peripheral nervous system interacts directly with the central nervous system. If you're going to hide from the immune system, best place to do it is either in an immune cell or within a nerve. If you do it in an immune cell, the immune cells get turned over. Short lifespan of only a few weeks. Evolutionarily, that means that you're always at the edge of being wiped out. Whereas our nerves, well, they're pretty much with us from the beginning to the end. So, best place to hide. You can go, say you get infected with chickenpox when you were 8. You can go until you're 48, 58, 68, having no problems. But you get into your 50s and your 60s and your 70s, and then there's going to be some form of a trigger. Extreme stress, mental, physical stress. You're immunosuppressed due to age or cancer treatment or some other disease. Maybe it's a drug surgery, a drug therapy you're on for something else. Whatever's going on, suddenly it will trigger the latent viruses to come out to play again. And this time you're going to end up with vesicles coming out, but instead of being head, trunk, they're going to be a line from the spine out across your back, in a line like across your shoulder blade, or a line just under the shoulder blade, or across the front of your chest out. What they're following is the innervation, because remember, it's going to be hiding in one nerve ganglion at near the spinal column, and it's going to follow out wherever in the skin that nerve ganglia innervates. So you'll see literally, as it's shown here in the figure on the right, this line of vesicles that starts at the spine and will radiate out. Depending upon which ganglia is infected with containing the latent infection, you will see a line out. These are extremely painful, itchy, scratchy, painful vesicles. You'll see this, as I said, patients 50s, 60s, 70s, 80s. You're also going to, because of this, you're going to get some, what they refer to as post-therapeutic neuralgia. Basically, there's going to be some nerve damage, inflammation at the ganglia in the nerves radiating out from that ganglia will lead to a tingling, painful tingling, kind of, pins and needles out on those patients. Can also lead to later nerve damage. So whether you're looking at chickenpox or shingles, we're talking human herpes virus 3, HHV3, also known as varicella. Can be spread direct contact with the vesicles of the fluid or more of a respiratory route. Attaches, the mucosa invades, could be a problem. Because if it goes the respiratory route, it's going to get down into the lungs, get into the blood. You have viremia. Viremia is a virus infection of the bloodstream, and then it goes everywhere. When it comes to transmission, well, it's human to human. The only way it can be done. There are no biological or mechanical vectors. It's direct contact or respiratory. Prevention. We've had a vaccine since the mid-90s. So chances are, if you're listening to this, you never had chickenpox. Your parents, grandparents, everybody else did. Um, We now have what is called Zostavax. It's a um, basically it's a booster. While you have, if you're older generation and you got chickenpox, you have the lifelong immunity. What they found though is it does wane after a while. Um, since you're constantly being exposed to it, but you're not getting sick from it because you caught it as a child, it kept priming your immune system. But what we're finding now is that since the vaccine's been out for the past almost 3 decades, the exposure of people out there, person to person, of chickenpox that used to be a natural immune booster is no longer there. So older patients, their immune systems are starting to, wear out, starting to lose their ability to fight off chickenpox. And this is where the latent infections are popping up. Shingles is becoming more and more of an issue. Also becoming more and more of an issue because our American population is aging, getting older. All those baby boomers, World War II era people, the baby boomers are getting older, and they're reaching that age where shingles would kick in. If somebody is having an issue with shingles, oral acyclovir is a good treatment. Acyclovir is an antiviral drug that is composed of what is called a nucleoside. It looks like thymine, looks like the T of the AGCT DNA bases, but it's been altered so that if it's inserted into new DNA strands, those DNA strands will terminate early. So it acts as a great antiviral because our cells can recognize that as DNA damage, repair, replace, but viral DNA, more often than not, will not be able to repair. So you can reduce the viral load, slow down the spread until the T cells can catch up.